What if I told you there are gonna be some really hard days? But what if I promise those really hard days are going to give you more time to have some really, really good days?
Hi, Heather. Thank you for
Hi,
joining me.
hi, Helene.
So, I am so glad you're willing to talk about this. I think this is such an important topic. So, I'd love to hear a little bit more about your diagnosis, and then we can talk about the actual clinical trial.
Okay, so I'm so glad to be here and advocating for myself. I was diagnosed with metastatic breast cancer in December of 2022. And 6 months in, I on a routine brain MRI, I found out that I had leptomeningeal involvement in my spinal cord fluid and met with a whole team of doctors at my cancer facility, Moffitt Cancer Center in Tampa, Florida. And we started right away on a plan to cure or try to help with my side effects and just treat my leptomeningeal spots from there.
That's great that you found a good place to go and knew how to take it on and advocate for yourself right away. Why did you decide to do the dendritic cell vaccine clinical trial specifically?
When I first met with Dr. Forsyth and his team, and they were explaining the new dendritic cell vaccine, it was scary in the sense that I was going to be patient number two. So they couldn't really explain side effects or how it was going to be on my system and everything. They could only tell me the basics of how they administer it and what needs to happen to lead up to it. But I knew that I wanted to try anything and everything to stay here and fight as long as possible. I had at the time a 3 year old at home, and I was willing to do everything and anything. And I was so lucky and I felt so blessed to be in a spot where they had an actual option for me to try. So I just knew I needed to do it.
Absolutely. Um, can you share a little bit of what it's like going through the trial, kind of the ins and outs of the day to day?
So it starts with they harvest your, is it the stem cell?
Mhm.
I think it's the stem cell through apheresis. So that's an all day event at the hospital where they take all your cells and they make your vaccine specific with those for you. And you go into the hospital, check in, they do labs, make sure those are okay. They start making your vaccine, they bring it over. Um, there's an Amaya port that you receive the vaccine in intrathecally, and sometimes it would just take a few hours for them to make it. They would come in the room, they would pull spinal cord fluid off so that the pressure wasn't too much, and then they would administer the vaccine through the Omaya.
So,
Um,
quick question, Heather. When they get the cells in the beginning, is it through the an IV or through the Omaya? Where are they getting the cells from to first
the
make?
the apheresis, they actually did like a little incision on one of my arteries and they did it through that. I think sometimes they could do it through a regular vein, but I've had chemotherapy before that and my veins just aren't great. So they just had to do it through my neck.
Okay.
And in a reel that we're also going to be sharing, you kind of the first couple pictures are when they were actually doing the apheresis. So you can kind of see what that kind of looks like. Um, and so then they would give the vaccine, and some days I would wait 4 hours after that. So then they could pull more fluid to test. Um, the days were long. I would say on a regular vaccine day, I would be at the hospital about 6 hours. And then when we would have to wait those 4 more hours and pull more fluid from my brain to test. Those were a little bit longer. The vaccine itself the whole process was a bit difficult. The side effects, I would sometimes right after they would administer the vaccine, I would throw up and get sick. I found that not eating a heavy breakfast beforehand was better. And also having a caffeinated beverage beforehand, for some reason, I think that that helped my headaches
Mhm.
because mostly the side effect was the headache pain and the pain between my shoulder blades, like through my spine, was what was making me sick. I don't think that the vaccine itself was making me nauseous and throwing up. I think it was just the pain
Right.
that I was going through was so high that it was making me sick. But the side effects only lasted probably 36 hours. And then I was back up, chasing around my very active toddler at the time and being a normal parent and active. It was just the 36 hours that I was down.
That's amazing. And how long did you do the trial for?
So the trial was supposed to be, I can't remember if it was 12 or 14 weeks, but since I was patient number two, they were still learning on what they needed to take. So they had extra, which they had offered me. And I thought to myself, like, yeah, those were some really hard weeks, but I will kick myself if I don't say yes and accept the extra ones that they have pulled for me. I would always be wondering, what if I did that? What if, that would have bought me more time? So I tend to just say yes to try everything. Like I said in the beginning, I want to do whatever I can. And so I agreed. So I think it ended up being actually 16 weeks.
Okay, so even though this was hard, you would still recommend people looking into this trial?
I would definitely recommend. It's bought me so much more time and it was hard, but it was more than worth it. Um, like I said, it was only 36 hours down and the rest of the time I could be a parent. I can enjoy my family. I've had no evidence of disease in my spinal cord fluid since ending that trial, which has been amazing. And now I've just been on what I would call as a maintenance treatment intrathecally through a second trial with the same team.
Incredible. Were there any positives with going in for treatment that you can share?
Yeah, the positive, besides the fact that it's given me, so much more time, it's been plus 2 years for me now. But it seemed like every time I was going, even though they were long days and they were so hard, the practitioners that I was meeting with for the trials and the long days have become like family. I spend so much time with them. They're all so lovely and so great. I literally feel like I'm just chatting with my best friend, my girlfriend, like the whole time we're there. We're just, they know my whole entire life. I know their life.
Right. That's
Dr.
amazing.
Forsyth cracks me up. He is so hilarious. I feel like we get each other, we bounce ideas off of each other. Like he inspires me, I inspire him, and we're just one big family.
Oh,
And they just really have the bedside and the brains for everything. It's best
amazing.
of all the worlds.
That's amazing. Yes, we're both big Dr. Forsyth fans, so that's
Yes.
great. Well, anything else you'd like to add?
I would like to add something that one of my heroes has said from a wise man, Dr. Forsyth. I'm going to quote him. You have to wake up every morning and choose hope. Hope and science are the same thing. And that's what's gotten me, 24 plus months. And I'm still very active. My quality of life is great. And it's all because of this team and hope and science. And is just amazing. And I would just like to offer to be your advocate, help you advocate for yourself. anything anyone needs, just reach out. I want to say yes to everything. I'm an open book. You can ask me anything. I will shoot it straight. And also, I want to add just to be your own advocate. If you try this and it doesn't work for you, then say no. They're very open people too.
That's amazing. Well, thank you so much, Heather. This is so helpful. We will put Heather's comment or Heather's information in our post. You can reach out to me if you want to contact her if you can't get in touch with her directly. And feel free to ask any questions because we know that this is a great option for many people. So thanks, Heather. We'll talk to you soon.
Thank you. I hope you guys find this very helpful and hopefully you guys can try this trial.
Great. Thank you.
Thank you.